A nurse for 40 years, the last 20 in a Calgary intensive care unit, but just 18 months of COVID has taken its toll.
We're just frustrated and tired and wish we didn't have to deal with this again.
Her ICU already scrambling to make more space, preparing to double bunk COVID patients. Still, she worries it won't be enough this time.
I dread the day that the physician has to decide whether a 25-year-old will get a vent or a 50-year-old will get a vent.
A familiar lament as cases continue to surge in Alberta. To slow this fourth wave, the province now dangling $100 in front of the unvaccinated. An unpopular move for some at this Edmonton vaccination clinic.
I think it's ridiculous that they've had to go to this extent instead of managing things a little more effectively early.
Well, no surprise, the opposition is critical of the government's response too, continuing to push for vaccine passports.
Do the right thing, allow those who have gotten vaccinated, who are protecting themselves and their communities, to be able to have access to the things that they enjoy in life.
A province-wide mask mandate is back. Sales of liquor at bars now stops at 10. But will it all be enough to bend the curve in time?
You have to wait 2 weeks, normally 10 days, to see an effect on the exponential growth rate. How much have we bent down the curve in Alberta? But the problem is going to be if the ICUs are full, you don't have a lot of time to play with.
The worry that Alberta waited too long to act, that this latest wave will soon come crashing down on the province's healthcare system.
So Erin Collins joins us now at that awkward distance of this COVID era. Erin, looking at the official numbers, clearly it's terrible, but I get the sense from you that actually it's substantially worse.
Yeah, that's right. I've been speaking with people connected to Alberta's contact tracing system, and they're telling me that as bad as these numbers are, many more Albertans could actually have COVID. They're saying to me that since the province rolled back testing and quarantining of close contacts of COVID patients, many positives are slipping through the cracks. Now, this former contact tracer wanted us to keep her identity secret, but felt the need to speak out.
I don't believe we're capturing even half of the positive cases that are out there right now. And a lot of that is because people don't know that they've been exposed.
And Adrienne, we asked the provincial government about this, and what they said is that they're counting on Albertans to contact their close contacts after they test positive for COVID. So really, contact tracing is being left up to them.
Okay, that's tough. Erin, thank you very much.
You bet.